Restrictions may be lifting across Oregon, but coronavirus is still a concern for people as they venture outside their homes for the first time in months. While doctors are still working on a cure for this virus, lower income communities might be most at risk.
Those same inequities exist in healthcare. They may not be as obvious. They may not be as violent, but they're just as prevalent.
While America has been at home waiting out this pandemic, COVID-19 has reportedly been disproportionately affecting low-income communities and people of color. But it didn't just start when the pandemic began.
Everywhere we look, we see instances where poverty and various social situations go hand in hand with certain public health risks.
A New York Times article in May found Oregon is one of many states where the Latinx population has shown a higher level of impact from the virus. La Clinica CEO Brenda Johnson says that rings true in Southern Oregon.
Disease and injury is higher for Black, Indigenous, people of color, and in communities. And when we see the data, not just in Jackson County, but across the country, about how COVID is disproportionately impacting people of color, we have to ask the question of its cause.
Dr. Shames says Jackson County Public Health has also seen these disparities and are working to address it, especially as farms begin to harvest.
So that we can be prepared as that community comes into, as those workers come into our community, that we're prepared to provide testing and surveillance and provide guidance to minimize the risk to them.
After years at La Clinica, Johnson is now taking an extra step to help clients, working on the state health policy board to create change, hoping to address some of the systemic issues creating the problems in the first place.
And how we recognize and fix both historical and contemporary injustices.
But Johnson also says the beginning of fixing some of these disparities, both in the healthcare system and our communities, starts with you.
Simply recognizing that we've got individual belief systems, and in those belief systems, they are what create the conversations that we have around our dinner tables. And so at the individual level, how do we learn more so we can do better?
There are options here in Southern Oregon for those who need it most. Along with La Clinica, there are coordinated care organizations like All Care Health who work to bring health care to diverse communities in our area. Live in Medford, Devin Gooden, NBC 5 News.